We were alerted yesterday that there was a Florida resident in Washington State who had tested positive. We've since found out that there's a total of 5 Florida residents who had been traveling from China, were quarantined per the federal government, have tested positive. Now, they're not going to be released from quarantine until they test negative, so we don't anticipate that having any impact on the people actually living in Florida. We did, though, this morning get another presumptive positive test for an individual elderly with severe underlying conditions in Santa Rosa County. He had been doing international travel. He's not in shape to fully answer all the questions, so there's an investigation ongoing. But that is a presumptive positive. It's not been confirmed by the CDC, but I think we're at the point now where, with the local testing, we're highly confident that that's going to be verified. And so, Department of Health will put out more information on that, and obviously the investigation is ongoing. But that is somebody who did have underlying conditions, and then I think he's over the age of 70 and had been doing international travel. And so if you look at the data that's coming out, Dr. Fauci at the press conference yesterday at the White House talked about for people who are elderly and frail and people who have underlying medical conditions, that is overwhelmingly the audience that is, or the groups that are most susceptible to COVID-19. South Korea has been doing a good job putting out their statistics. They've had over 5,000 cases, and they've had no fatality under 30 at all, and very few even under 50. And the fatalities are overwhelmingly people who are elderly and who have underlying conditions. And so we, earlier this week, put out guidance for the nursing homes, assisted living facilities. Yesterday, HHS CDC did something similar from the federal level. So we really believe, looking at the data about how this virus is affecting people, and then if it is affecting certain demographics, then obviously, we want to make sure that people are wise to that, and that the people who run nursing homes are taking appropriate responses.